So you're at home, you know your client just undressed and they are ready. Anything else I should change in here? Do towel. Who wants to do it? Who knows how, we feel comfortable to do that? Come on, Gintare. Come on, you do that. Come on. We're waiting, we have a long day.
I'm not doing it.
Yeah? Yeah. Good. That's the only thing. You give it a go. And, yeah? Good. And you're holding both of them. Good. Yeah. All the way. Good. Fantastic. Yeah. And continue a little bit if you remember how to. Yeah.
And this comes over.
Yeah. And then you tuck this one under. You tuck this one under. Great. Now I reassure you that Maria would never forget it. Good.
Sorry. Should we do this really?
Tuck this one under. Good. And then, good. Fantastic. So how do we call that kind of towel? Tea towel. Yeah? Because this is long and this is wide. So even if the client having their hands to the side, can you put your hands to the side? Yeah, they're still covered. You see, it's warm. It's really nice. Fantastic. Good. So I'm here. I'm prepared. I can do my own preparation routine, and then I start with just putting my hands there. Okay. Now you tell me what happened when I do that.
Signal to the brain.
I send signal to the brain to relax. Fantastic. Yes. Good. Sorry? I'm connecting with the client. The client feels that I'm there. I'm going to be nice to them, yeah?
Hopefully.
Please be nice, yes. I'm not going to be the therapist that says, come, I would hurt you and make you feel better. Yeah? On the same way. Good. I also assess their breath, the speed. Good. Then I can start. Good. Can I undo the brush? Thank you. Good. If you want, you can come a bit close. Good. So starting with effleurage, right? Right. Remember the legs movement? Effleurage a lot to do with the legs. Good. Starting very slow. Right. Now let's think about the blood circulation to the muscles. I mean, do you see how I squeeze the fluid under the skin? Yeah. So I don't go deep. It's not like I improve the blood circulation inside, but around, through the whole limb. Good. And I also relax the person, and because of that, what do you think would happen to the muscle tone? You have to do some thinking. So the muscle tone, if you relax, does it go up, down, or up?
Down.
There you are. Good. Good. So then after that, here comes the petrissage, yeah? A bit more dynamic. You can see how now you get into the muscles. By the way, which muscle I'm going through now?
Trapezius.
Trapezius is upwards, more. Erectospiny. Erectospiny. Good. And who did this area? Where's Martin? Yeah? Who did yesterday this muscle? Do you remember how does it called? Quadratus lumbarum. Yeah, do you remember that? Yeah? It's very good muscle to work. If somebody is having a backache, you're not working from here but from the side. Quadratus lumbarum. Very nice. So I'm kind of work and negotiate with the muscles to relax more. I work deeper. But let's say I work in here, I did my petrissage, I feel now there is a local tightness.
Yeah, right shoulder.
Right. Right.
Get in. Thanks for eating.
All right. Okay, I'll go. Oh, yes, you're right, actually. In the right shoulder. So now I'll ask the camera to more show the posture as well. So you are getting into, you need to apply deeper pressure. And you start a technique that's called compression. In the compression, it takes time to organize yourself and then to find slowly where the point is, and then slowly to sink in by using your body weight. You see, I don't do that, yeah? I use my body weight.
Yes.
Good. I bend more my knee. So there is a bending.
And you lean forward.
And I lean forward. I lean into it. I try not to do it with my hands, but through my weight. Now, what is the risk of doing it for her? Too much pressure. Thank you. Exactly. So how can I know that there is not too much pressure? I can ask her. First, yes, you're right. She might respond to just saying, ouch. But let's say she's very English and polite, and she doesn't want to say that. So you have to ask her. Now, you have to know also how to ask her, because you can ask her, how is it? She can say, well, all right. And then think, okay, it's all right, I can continue. Not very good. So you have to ask more specifically, how is the pressure? And you do it by saying two things. How is the pressure?
Yes, good.
Can I go deeper?
A little.
Sorry?
A little.
A little, okay. So I know that I'm there. Yeah? If she would say too much, then, or if she would say more, then, okay, so remember, it's not how is it, or how you doing, or what's up. It's more really, how is the pressure? And then, can I go deeper? Yeah? And this should be really automatic for you. When you start treating someone deeper, so, how is it?
Yeah, good.
Yeah? Can I go deeper?
No.
No, okay, so I know. And then you keep it, and then you go a little bit out, and then you can do a little bit of effleurage, and then you're ready again. Good. And then you assess, and then you feel, okay, how does it feel? You might do a bit more petrissage, and then move on.
So did you feel the tension when she said the left, the right shoulder?
No, it's not. I'm not assessing right now.
Okay.
I'm teaching technique,
Okay.
and it's not within the assessment. But I show you the sequence of hold, effleurage, petrissage, and then through the petrissage you start feeling, and then you're doing the technique, compression. Yeah. So then you don't think that you can do it right away without warming up the body. Okay. Now, few alteration. What I've done is the compression with my thumb. Yeah? So what I did is put the fingers there, and the fingers support me, so I don't glide, and then slowly I put the pressure. I can do it pretty much the same, but with a reinforced thumb. Yeah? Two together. I can do that, remember the finger petrissage? I can just do that with a finger petrissage. So I do a local static pressure and a little bit of movement. Yeah. So what's the difference between petrissage and compression? Petrissage has more movement. Yeah? It's more squeezing, moving the tissue really. Compression, it's a lot more static. You can move it, but you see the moving, it's very minimal. Okay? So you can do that in few ways. You can do it with the thumbs, reinforced thumbs, finger. You can do it with the finger support that way. You can do that later even with your knuckle, with one knuckle, like that. Yeah? But be careful, be more confident when you're doing it, because you don't want to glide. The risk is, when you're superficial, no risk. When you go deep, you're more responsibility. You can't start moving when you're deep, because it's going to hurt. So you have to be very clean in your work. Clean means you can't put a lot of pressure and start moving like an elephant around because it's going to be hurt. It's going to be painful. You can move when you're doing superficial work, but when it comes to deeper work, you have to organize your body. You have to see that you're in the right position and slowly increase it. Can I go deeper? Is it good enough?
You just pick one spot or you do a few spots in the area?
I do. It really depends if it's more tight or not. There is no recipe really.
Are there, apart from the spine, you wouldn't do compression on the spine,
Mhm.
obviously. Are there any other areas on the back?
Oh,
or on the
plenty,
neck?
yes.
You wouldn't do it on
You
the
can
neck
do that
either,
here.
would you?
Not in the front,
No.
but yeah, here on the suboccipital,
Yeah.
yeah, on the neck, yeah. You can do that on the shoulder, yeah, shoulder, on the. I'll start introducing you to muscles. So this called infraspinatus. Infraspinatus is usually very tight. Deltoid, you can do that. You can do it on the triceps. Yeah, yeah, you can do on plenty. Yeah.
How about, is there any place you would not do that?
On the back.
Well, sternocleidomastoid in here, you know, you have to be careful because of the throat. Yeah.
Or can you feel this knot?
Oh. Can you feel
Which not?
Because she
No,
said she
you
got.
said-
Oh, you know, I don't. When I do that, I want you to learn more to do that. It's not about feeling the knot now. I want you to practice it, and when you feel it, then you can do it. Okay? Shall we start then?
Yes.
Tables up. So I'm going to go there, and how many? We're 24, so we need 12. So we need 11 because we have a few comments. First of all, when you're practicing, go more to do the technique that you need to do. I know that there is. It feels great to just do everything, to do the whole sequence, but you really want to practice on. So I'll show you all the technique just to show you how is it going to be incorporated, but really go as quickly as you can into the compression. So few things. First of all, about the application, you know, the fingers. If you keep your thumbs flat, it's going to be very difficult to put pressure because you see how many braking force, the force from my body should be straight. So I prefer to do that thumbs, yeah, than the flat one. Can you all try to push onto something with your thumbs this way and when your thumb is flat on the table? Yeah? And when your thumb is flat on the table like that. So it's a lot harder. So try to really work that now. Now the thumbs, so there is that technique with the thumbs. You can do reinforced one. You can have another one, which is another reinforcement, that you put your wrist almost onto the place, onto the thumbs. Now, there is a difference between that one and this one. That one, I just hold my wrist here. I don't need to support it. What I need is to have all the forces from both hands getting into one place. So you need to do it this way. You can bend it and then put more force in. Okay. You can do even more. You can do it with your elbow, or with a forearm. But yes, you can. But let's not do it now. We'll do it once we do the elbows. Okay. Okay. Another application is the fingers. You can do that with the fingers. It's very similar to finger kneading, but the difference is that now it stays more or less on the same spot. More or less on the same spot. You're releasing it, letting the blood circulate in here, and then again squeezing the blood away and going. Yeah? Another application you can do with one finger, one knuckle. So you have your thumbs here as a support, other hand support, and then you press down. So plenty of different applications. Yeah. The second thing is your body. Yeah. So as long as you putting your weight on it, that should be fine. You can do that with one leg in front, or you can do that with two legs backward. Yeah.
Well, that one tiptoe.
Or you can do tiptoe. Yeah, definitely.
Yeah, that's right.
Yeah. Sometimes the tiptoe is a good position where the table is a little bit high for
Yeah,
you,
that's
and all you need is just to go on. Yeah, you can do that. You're not staying for a long time. Try not to have the shoulder really down. So really go down this way. Okay? And you can't stay there for a long time. Okay. So let's try these. Now another alteration or similar technique to compression is basically that you do compression and you move your fingers more. So compression, as the word means, you just compress. Yeah? You can move it across the spine, across the muscle. Again, the difference is between that technique, compression, and something that we'll call from now friction, that you just do that. Now, which one can irritate more? The friction. So you need to be careful that you do it very slow and very little.
Start gently.
Very gently. So you can't do it very quickly. There is a very interesting relationship between depth and speed in massage. If you go deep, you have to go slow. Exactly. You have to go slow. So be sure that you are safe. You can't go deep and start moving because it will really hurt them. You need to be stable, find a place, and then this is compression, or this is compression, and then friction. Can I go deeper, Osaka? And then slow down. So compression is just that. Yeah? Friction, you move, but you move a little. Yeah? Now, just to warn you, there is another type of friction in massage, and that's that. That's very superficial. Only skin level. The friction that we're doing is fairly deep, okay? So just be sure that you understand that.
Mm-hmm.
Any question?
Do you think getting the client to breathe in and out when you're doing
You could,
pushing
yeah, thank
might
you.
help with
You
the
you
pain, like the
pain threshold, yes. You can do that by asking them to breathe in, and then when you breathe out, you increase the pressure. And then you stop the pressure. You stop increasing the pressure. Breathe in and breathe out. Every time they breathe out, you can increase the pressure a little bit more. Yeah? So you can try that, working with breathing on the thoracic spine. Other area that you can do that, trapezius muscle, really good. And please don't come from here and try to do it here. Yeah? Every time, think about forward. So you're coming here, and that's the direction. That's the easiest way to do that. If you want to change it to that shoulder, then change. If you want to change it into this muscle, then change. Yeah? Okay. Neck, you can't do friction down. What you need to do is kind of compression in and lift. Yeah, and lift. So compress, because you don't want to increase the lordosis by pressing down. Suboccipital area, really nice area, fantastic. Really, really good. So a little bit of compression around to just make it very soft and nice. This is a lot of tension headache starts from here. Back, lower back. Yeah? This one would be a lot easier than that one. Because here, I don't have a good access. Here, my access is a lot better. Yeah? Even going into the gluteal muscles, yeah, you can do that on the sacrum. Yeah, on the sacrum, around the sacrum and the gluteus muscles on the side of it. Yeah, gluteal muscles as well. Which muscle is here? Who remember?
Oh, the hamstring.
Where is? Yeah, which muscle was on the back that you drew? Hamstring. Which one was in here? Gastrocnemius muscle. Yeah. I'm start asking you more questions about it. Okay. Should we practice that? Yeah?
Yeah.
10 minutes each? A lot more. Finding your position, flat versus upward, reinforced again, finger, yeah, knuckles, and then the difference between static compression and compression with a little bit of friction. In the compression with friction, you don't move the area where on the skin. You stay on the same skin patch and then you move. You don't exceed, you don't glide on the skin. You stay on the same area and you friction the muscle, not the skin. Shall we give it a go? Good.